Hello, my name is Alison Walker, Chair of JRCALC and Executive Medical Director at West Midlands Ambulance Service. Welcome to this short video presentation for the JRCALC Clinical Update 224, the second release for this year. I will give you an overview of the updates that have been introduced in this latest release and also point you to further video presentations that go into more detail on some of the bigger updates that have been completed. Guidance for dyspnea and altered level of consciousness have been fully updated and revised in line with NICE guidance. Sexual assault has been revised and simplified with more emphasis on accessing SARCs and not leaving the patient alone with the perpetrator. As part of the ongoing JRCALC review into equality and diversity in the guidelines, a number of guidelines have had small changes made to the wording regarding assessment of skin. Skin tone refers to the individual combination of pigmentation in a person's skin, while skin colour can change when a person is unwell. We highlight that skin changes should be assessed closely using natural light if possible, or non-fluorescent light to avoid a blue tinge. Examples of skin changes include cyanosis and dark skin. Consider moistening the skin to enhance the visibility of skin changes. Heightened skin colour or flushing may not be detected or be more difficult to detect in dark skin tones. Assess for local skin temperature changes too. Mottling may not be easily detectable in all skin tones. We respond to new evidence and the many queries and feedbacks that we regularly receive, and this has led to a further few small changes in this update. Following feedback received on some changes around hypothermia that came into the JRCALC Clinical Update 124, we're making a small update wording change around measuring temperature in cardiac arrest. Two new bullet points have been added to section 1.2. Firstly, in witness cardiac arrests, generally you do not need a temperature to be taken as part of the cardiac arrest management. Secondly, if there are circumstances where hypothermia may be an issue, then consider taking a temperature prior to drug administration, for example in unwitnessed arrests, in drownings, in those with a prolonged exposure to cold. Following some concerns raised about a naloxone indication, we are removing the indication around administering naloxone to patients that are exposed to high-potency veterinary or anaesthetic preparations. In the Asthma in Adults and Children guideline, we have responded to a coroner's prevention of future death recommendations from a tragic case into the death of a child with severe asthma. We've made a number of small amendments to the guideline for better clarity, where we wanted to place more emphasis on the need to assess and determine the severity of an asthma attack and the need for early consideration of the administration of magnesium and adrenaline in life-threatening asthma. We've also revised the table of features for the assessment of asthma severity by using red, amber or green colour coding, and we've amended the asthma algorithm to align with the colour coding in the table. We've also removed the near fatal arrow on the left-hand side. All the updates for 224 can be seen on both the JRCALC Plus and the ICPG apps within the Guideline Updates box at the bottom of the dashboard. Users will also see the updated tag on the guideline or medicine itself within the Guidelines and Medicines tabs. I would like to thank all the clinicians, including paramedics, pharmacists and others, and the many people who have given up their time to contribute to these updates. We are always keen to hear any feedback, so please do get in touch.